right, everyone. We're going to go ahead and get started. Good afternoon and welcome. We'd like to start off by saying thank you for everyone for taking the time out of your busy schedules to join us today. I think you're going to get some very useful information from a carrier with a lot of opportunity across the country. We're very excited to be joined by Molina Healthcare today, and they're going to go over some of their benefits, opportunities, expansion areas, basically everything you would need to know in order to be able to sell them successfully. But before I do that, I just want to point out a few things. This is our website that you're seeing on the screen right now, messerfinancial.com. If you scroll down a little bit, you'll see a calendar there where you can see all of our upcoming webinars. So, like for example, if I click the 25th, you will see that we've had two sessions with Molina. We had one this morning for the Florida, Michigan, Mississippi, Ohio, South Carolina, and Wisconsin markets. And this afternoon, we're going to go over California, New Mexico, Utah, Texas, and Washington. So make sure to always keep an eye out on the calendar to find out for upcoming trainings, because we do have them coming up, and also in October as well. Also, for those of you that are new or looking to still get certified for the ACA, if you notice right here on our website, it says FFM certification is open. That's the only thing that you'll need in order to certify to sell for the ACA. And then, of course, you just have to be appointed with the carrier, such as Molina. So if I click here and I hit Learn More, it'll come over here and it'll give me a few different walkthroughs. So if you are a new agent, which basically just means anybody who did not certify last year is going to be considered a new agent. You would click New Agent. It's going to give you a step-by-step walkthrough. If you did complete your FFM certification last year, you can hit the returning agent, and some steps will be eliminated, and you can go right into the training. I'll tell you guys, it's completely free of charge. Just make sure you use CMS to complete it, and it should take you no more than an hour, I think, to do it. It's pretty simple. You just go and listen to some modules, and then you take some tests afterwards, and then you're done, and you're certified, and that meets it for all states, all carriers. Your requirement is done. Also, there is a system called Help on Demand. For those of you that haven't signed up yet through healthcare.gov, I highly recommend it. What Help on Demand is basically a way for you to get free leads. And they do that by you're basically processing your information as someone who's looking to assist people. You give them a certain time frame of what you're wanting to work, days, language preference, all that. So you're basically building your criteria, and then based off of that criteria, whenever someone is looking for additional help, they will be able to send it over to you. Now, of course, there is a time frame for how fast they want you to contact the clients, but as long as you do it in a certain amount of time, then you will be approved, and you'll be able to continue to work them. So, like I said, if you haven't done so, read through this. It tells you what it is, what are the benefits, how it works, and how to register for it. It's just free of charge, and it's just free leads. Pretty simple. Also, want to point out if you are new to this industry, or you just have questions in general about certain things, most information that you're going to need can be found on healthcare.gov. So for this purpose, I'll go ahead and show you. So we all know this is going to be a very common question, that the subsidies are based off of what they call the MAGI. That's your modified adjusted gross income. And you might say, well, what is all included in that? So if I want to look that up, all I have to do is type in MAGI, and then comes right up, modified adjusted gross income, how to estimate your household income. I click on that. It's going to tell you all kinds of things. If I want to know what is included in a MAGI, click that. It'll even tell you, learn about adjusted gross income, a number you can on your tax return, see what's included in MAGI, and how to estimate it. There's your biggest one. So look, it tells you federal taxable wages, self-employment income, unemployment compensation. All of those are included, and it goes on and on and on from there, and it even tells you different notes about it. So again, if you're wanting to know the most accurate, compliant information available, always go to healthcare.gov first, or of course you can always contact us or the carrier as well. We will give you updated information as well. As far as rates go with the carriers, unfortunately, And I'll just be honest with everybody here. For every carrier, we're really not going to know what the rates are going to look like until probably right before open enrollment kicks off. So I know everybody wants to know every single detail about everything, but the bottom line is until we can actually quote everybody, it's going to be hard to determine exactly where everybody's niche is. So my advice to everyone is go ahead and get appointed with the carriers. Make sure you know who's going to be in your area. Get appointed with those. There's no cost to appoint. There's no production requirements, and like I said, there's no additional certification. So we're talking about something that is a very little time spent doing, and also free of charge. Make sure to get appointed and do it now, guys. I'm telling you, if you want to be ready by November 1st, go ahead and submit your request now, because as we get closer and closer to open enrollment period, it's going to become harder and harder to get people appointed, and it just slows the process down, because obviously the carriers are get a huge influx of requests that come in all at once. So try to get it in as soon as possible. If you don't know how to request your appointment, you can go right to our website, messerfinancial.com, under Agent Resources, Online Contracting, and then you can begin your whole process if you don't already have Assurance Bay profile. Jeff, is there anything else that you wanted to add that I'm missing before I hand it over?
I think that's a good segue into what we're going to look at, and then we'll take some questions as we go along, and then we'll close it out with some more ideas on how to best market some best practices for the agents as they prepare to ramp up for the OEP.
Sounds great. So with that, I'm going to turn this over to Amy with Molina, and we'll just go from there. So Amy, it's all yours.
Fantastic. Thank you so much. All right. I'm going to show my screen here. Appreciate it, Micah and Jeff. And thank you all for joining today. My name is Amy DeMarco. I'm the Director of Sales for our Western region. So we're joining Camp Molina again. If you guys were on the morning training, apologies. There's going to be a little bit of a recap on some of these shared slides. But for anyone new, I wanted to make sure we hit the highlights about who we are as a company, and then we'll get into, we'll kick it over to Texas so we can get into the specifics for each state after that. So let's move on here to our open enrollment periods. Of course, you know, the FFM is going to stay the same this year, November 1st to December 15th. Washington Health Plan Finder, you got a few more days in Washington, so another 30 days if you guys are selling on Washington Health Plan Finder. And then Covered California, luckiest of all. I'm in California, so I'm a little, biased. We do have the full 90 days here, plus renewals will start October 1st. We just got confirmation on that. So we're less than a week out from folks being able to shop and compare and switch plans. Also, we've kind of had the never-ending SEP here, so there is still an option for folks to enroll right now without having documentation for their qualifying life event. So if they select loss of income or change of employment, they can, basically come new to the exchange here in California without requiring any documentation of SEP. So keep that in mind. If you guys are selling in California right now, it's the law. We have 90 days for open enrollment now for the foreseeable future. So there won't be any changes to that going forward. So, again, just a plug for California. And Micah did mention that, Help on Demand is available for healthcare.gov, but it is also available for Covered California. So if you are selling in California, they do have free leads that are sent out to you guys. It's on basically a priority basis. If you respond to more calls in a more timely manner, then you get more calls. So get onto Help on Demand. It's called Big Wave for Covered California, but basically the same process. So yeah, free leads coming your way in all states. All right, talking about Molina a little bit, we started as a clinic back over 40 years ago in Long Beach. Dr. Molina realized there was a need that wasn't being met by the current healthcare system for underserved communities. And this was, back before we really had the Medicaid program built out. So he, was integral in this community, building out the healthcare structure here. And then we became a Medicaid company, Medi-Cal, here in California, and grew to the company that we are today. So in 15 states, 11 of those are marketplace, serving 3.5 million members. I think at our peak, when we grew so rapidly on marketplace, we were close to 5 million, but we are really focused as a company on growing strategically and sustainably. I know we've had a bumpy couple of years as we went through a reorganization and a quote unquote transformation as a company. And I think everything you'll learn today really shows you that we are on the right track. We are investing in this product line. We are trying to grow as methodically as possible, and we are here for the long haul. This is really going to be our flagship product line. And that's not just because I'm on this line of business, but really this is where the future of Molina, and we're going to be seeing, even though we're not expanding to new states this year, we've heard quite a few new markets that we're looking towards for 2022, and we have big county expansion this year. So I'll be touching on that in a minute, but I do like to reiterate that this still runs like a family-run company, even though we are publicly traded now. For the last 14 years, I believe, we like to treat every member like family, and that is even more true now that we've restructured, and we are doing so much work internally to make sure members have the best experience possible. And part of our vision was a change as well. We still are focused on government-sponsored programs, but we want to be the lowest cost, most effective plan option for members in our markets, and we are still serving just Medicaid, Medicare, and Marketplace. So that's why you're not going to see us off exchange or in group plans, because we really have been historically Medicaid company, and we want to be there for that low income member. And there is a lot of churning between Medicaid and Marketplace, so we want to make sure that we can keep those folks having the same access to doctors and care regardless of slight income changes that they may face. And we are the only Fortune 500 company in Long Beach. I like to highlight that. But nationally, of course, we are in the top 200 as well, 193. And 15 markets, as I mentioned, not all Marketplace. We're only in 11, but stay tuned. Big updates coming for us in a couple in future years. And we're seeing about a 40% increase in our Marketplace county footprint this year. So if you guys are on the morning call, you heard we're expanding to all of Mississippi. We are seeing a big increase, almost, well, not exactly, but almost doubling in South Carolina and Texas. So that's the highlight for our expansion in the Western region. We are looking at San Antonio, some contiguous counties to Harris, so kind of the Houston metro area, as well as the Fort Worth portion, 2 counties of Dallas-Fort Worth. And all the gray on this map, I know I've had a couple questions about that because it's not on our key here. Those are our Medicaid footprints. So if you're not familiar with Molina, we typically enter markets based on RFPs that we receive for Medicaid. And then once we have, a good foothold in that community, we have all our providers contracted, then we roll out our additional lines of business, Marketplace and Medicare where applicable. So where you see gray on this map, it's probably a good indication that there might be some opportunities in those areas in future years for Marketplace expansion. So stay tuned on that. And rate changes. As I mentioned, this product line is key to the future of Molina. I know we pulled out of Utah a couple of years back because we just had to right size the product for that state, and we came back in slowly, but we're coming in full steam here. It's almost a 2% decrease in Utah, big decrease in California, 4% on average for all metal tiers, 5.5% decrease in silver alone. Texas, we're seeing a bigger increase in bronze. That's why you see a 5% increase there, because we were the lowest cost by quite a bit last year. But we are seeing, a decrease in our gold plans there, as well as basically staying flat more or less. I think it's a 2% increase on some of our existing silver plans. But as you'll learn, we are rolling out new plans, $0 deductible bronze and silver plans. And so we're hoping for those to be more competitive price-wise and seeing kind of a shift to those plans. So again, some of these increases are not as big as they might appear because we are rolling out new plans as well. Washington seeing a 2% decrease, as well as New Mexico is 0.18, but you'll see as we get into it, we do have some pricing for our Western states already. Nothing finalized in the FFM states, but California, you can take it to the bank. We got some good info on our rates here, which I'll close out the training with those. And our field rep. So I am now our director for the West, but I was, as of a couple of weeks ago, our marketplace sales manager for California. So I am still your resource for California until we can get somebody in this position. So if you know anyone who's in California would make a good rep for Molina, please send send their resume my way. And you'll be hearing from Gabe next in Texas, then Adam Grimaldo in New Mexico and Utah, and then Casey in Washington. And then you'll hear from me again. So you'll be hearing my voice quite a bit today. And I do want to reiterate all of the resources that we are outlining for anyone impacted by coronavirus. We know it's been a very tough year, a lot of strife and concern across the board. And we are very lucky. The person who heads up our marketplace operations is also our chief medical officer. So he is fully engaged in the member experience, in the provider experience, and making sure that we are doing everything possible from a line of business standpoint, but also as a company to meet the needs of our members. So that's why for the rest of the year, we are covering all out-of-pocket costs related to treatment for coronavirus, any testing, negative or positive, in-network, out-of-network, doesn't matter. We are covering those costs. And that also applies to the out-of-pocket expenses. You know, if they're admitted to a hospital that's not in-network, we are covering those costs at no cost to the member. So, you know, let them know the rest of the year if, you know, fingers crossed there is no additional spikes and they can, you know, get back to life a little bit more normal. You know, we probably, hopefully won't need to extend these programs, but if we do, rest assured, we will be extending those, waiving of costs if we need to. And Teledoc, we waived the cost this year, and I have a slide coming up that'll show you, but I'll give it away right now. We are covering all telehealth services at zero copay for the future. So no cost to accessing our Teledoc benefit. Our partner is Teledoc, so you know, they can log in through Teledoc's portals or app, or our portals and app as well. They can access, it's being integrated, it is integrated as we speak in our My Molina portals as well as our Molina mobile app. And this will continue, I mean, our 24-hour nurse advice line available to all members, as well as free home delivery through CVS. They can usually get a 90-day supply delivered to their home at no cost. And I buried, I gave away the lead on this one, but yeah, telehealth through Teledoc. Yeah, I know this is extremely useful in this day and age, especially, you know, with folks being concerned about, you know, exposing themselves to anything as they go to, you know, access the healthcare system. So rest assured, this is going to stay a free resource to all of our members in all lines of business. So if you have folks, you know, on Medicare, that is going to be free of cost as well, but this is, you know, free of cost to Marketplace going forward. So premium payment methods, I like to highlight this because we really try and make it as easy as possible, painless as possible to make a payment with us. They can make a payment at time of signing through our Pay Now portal. You can select a doctor as they're doing the application. So once you make the payment, then the PCP selection page will pop up, and you can also set up auto pay at time of signing. So highly recommend getting your members on auto pay just so they can set it and forget it, not have to, you know, forget about making payments. I know sometimes even, you know, my credit card payment, I'm like, oh, whoops, I got to do that. Yeah, you know, same thing goes. It's just easier to have it set on auto pay if you can, and we want to make that resource available to you as a broker to be able to set that up for your members. If you don't do it at time of signing, they can still access that setup, and they can turn it off through their My Molina portal as well. And you can also make one-time payments. So if they don't want to log into their My Molina portal, if, you know, for whatever reason that is not accessible to them, they can go to molinapayment.com, and you can help them this way as well through molinapayment.com. You just need that subscriber ID, name, zip code, and state, and we'll take that payment on their behalf. And of course, the typical ways of making payments still available by phone. They can go in person to MoneyGram. You know, you can set up bill pay through your bank or by mail. And just some notifications. I know we get questions on this, you know, depending on, you know, where folks are, but really the notices go out. They're pretty standardized. So, you know, these are the notices that your members might receive. So if they have questions about what did I get in the mail, why did I get this, these are the notices that are going out. And our ID cards. We made a big change last year to ID cards, and honestly, I've had way fewer requests for replacement of ID cards this year because they're not laminated paper anymore. They are hard plastic, and so when they receive them in the mail, it's very obvious that it is their ID card and not part of their welcome packet. So I think, you know, there was a change to the card that we weren't including the PCP on the physical card just because, you know, folks can change their PCP really at any time. And so this way they can keep their card with them and not have to wait, 7 to 10 days after changing their PCP, and they might not have their PCP by the time they have their their card by the time they have their new PCP. So we thought this would simplify things for members so that they can always have this with them regardless of PCP or medical group change. And if they do want to see their card with their PCP on it, they can access that electronic version, and it will have that name on there through their My Molina portal or our app as well. So yeah, hopefully you guys have heard some good feedback on the ID cards. Just anecdotally, I mean, I haven't had to get too many folks new ones, so it's been, I think, a successful program. Just reiterate that they'll be receiving those in the mail and to look for the hard plastic card now instead of that laminated one. And our provider search, another kind of tool that we are doing a lot of investment in right now, providersearch.molinahealthcare.com is where you can access all of our online directory for hospitals, pharmacy, urgent care centers, and doctors and specialists, of course. So if you go to our main website, molinahealthcare.com, you can click on Find a Doctor or Pharmacy. This new look and feel of the search tool will pop up. They moved the quick search button to the top there because, that is a widely used tool. If a member knows the name of their doctor and they know they have to be in network, that is first top of list. So they just need the name, a zip code, maybe within 25 miles, and then the coverage, which would be marketplace. And then they'll get every doctor with a name of similar or same spelling in that region. And they can check very quickly if that doctor is going to be on board with us. And then you can do the search functionality here. But as I mentioned, we are investing a lot in this. We are going through a massive validation process right now, and we are assisting with that. So if you see anything that's not accurate on our portal from what we're sharing today, let us know. Especially in our expansion counties, we are getting it up to date as rapidly as possible. That we are growing very quickly and adding new doctors and hospitals constantly. So they're updating it as much as they can. But we're also going through and just double checking our current footprint and having the most correct information possible. I know a lot of locations have been updating hours based on, quarantine and possibly phone numbers and addresses. So we're doing a validation of all of our doctors and providers to get that up to date. So stay tuned. That should be ready to go well before open enrollment, slated, for the beginning of next month to have everything set as is. And we are looking at doing basically a whole new platform next year. So we'll give you more information on that, maybe our SEP training, but we are really trying to make this as user-friendly as possible. And we've been managing this database and platform ourselves for a very long time. And I think we're going to defer to the experts going forward, to folks who really, specialize in this so that it can, have a fresher look and feel and some expanded search functionality as well. We do have expanded search functionality currently. So if you have a doctor, a member who needs a doctor that has admitting rights to a hospital, language capability, if they're a PCP, you can make sure they're accepting new patients. And, even if they have medical groups that they want to be assigned to, you can check that as well. So you can check all those boxes and do a search for your member to make sure that they have access to the doctor that they need. I do this mostly with, pregnant, expecting mothers. They want to make sure they can deliver at their hospital with their doctor, and we can do that search here, not a problem. Make sure they're in network. Pharmacy services, still through our PBM, our Pharmacy Benefits Manager is CVS, so they can access any CVS locations, Rite Aid, Costco pharmacies, and innumerable mom and pop pharmacies. We also have them listed on there. And as I mentioned earlier, before I forget, of course, mail order services are available to our members as well. And then there's your broker portal. So another thing that we are investing in, you'll see a slightly different look and feel. You did an update, so some additional functionality, but really kind of more of just a streamlined visual here. And if you have not logged into your broker portal, the username is going to be your Molina agent number. So it's 2 letters and 4 digits. If you don't have that, let me know. We'll get that to you. And if you haven't set up your password or logged in before, you just hit forgot password, enter that username, and then they'll send you a link to reset your password there. And you can access this through molinahealthcare.com. So instead of selecting find a doctor, click the next one over, hit broker. You can sign in that way. There's also a couple useful videos there to walk you through how to log in if you haven't before. And your book of business. This is, the highlight of our broker portal. I'm very proud that, you can access your book of business active members, termed members, find out if they're in grace period, when they enter grace period. Original effective date will show you if they are renewal or new business, and on and on. So we are also working on adding in the member responsibility as well as their APTC amount, so their premium total will be in there any day now. We're expecting that to go live, so stay tuned for that. But this is another resource that we are constantly trying to improve and take your feedback and build it into this portal so that it meets your needs and is a useful tool for you guys. And this is what it'll look like. I really highly just recommend, downloading the Excel doc. You can see right here, there is a little Excel download icon, and then you can really get into it and mess around. Oh, this deleted my cover. Sorry, there's more information there. But highly recommend downloading the Excel doc. Just a note, when it says, do you want to submit this as a job, click no. And that way it'll download automatically. I know it's counterintuitive, but if you click yes, then you won't get the report. So just click no, and it'll download onto your page. And another resource we're making available, this went live for California, just for the individual families and members pages last week. And as of next Thursday, we're going to go live with our broker resources on this portal as well. So you can visit molinamarketplace.com right now. The one thing you won't see is this quoting functionality. So that is still being built out. That'll go live 10/1 as well. So stay tuned for some exciting updates on our standalone sales website. So this is really streamlined for this line of business to make it as easy as possible for your members to find the information they need, as well as for you guys to access, key resources for brokers. We are holding off on building out some of those pages right now, but going live this next week will be, broker support information, broker login, how to get contracted with us, key other contact information and resources, as well as for members, it'll be benefits at a glance guide, this quoting tool, and other resources for providers as well. And those resources that we'll have available for members are going to be our redesigned EOCs and summary of benefits and coverage. We're really trying to make these much more user friendly and easy to access and understand by our members. So they're going to be in color now. We're going to have more graphics. They're not going to be that basically look like a legal contract that is all medical jargon. A lot of changes coming down the pike for these. So I'm very excited to roll those out next week. And our member handbook, this is the first time that we've had this. This is really another key effort of our chief medical officer. He wants members to have as many resources as possible to make their experience with us as easy as possible. So the member handbook is another tool in their tool chest to, get the most out of their plan. And their Molina mobile app and My Molina portal are also getting a bit of a facelift and some enhanced navigation and usability. So those should be rolling out next month. I don't have target dates for those updates yet, but they are coming any day now. We'll let you know. We'll probably send out an update to our broker support unit once we have those. And hopefully you guys saw our Lean on Molina campaign last year, but we are going to be investing 3 times the amount in marketing this year than we were last year. And that is just on Marketplace. So it is a very, very good indication of where we're going and how much we value you guys as partners and this product line overall. This is really, key to our growth as a company, and we want to bring you guys along for the ride and grow your book of business as well. And our broker services team is here to help. They are, Tina talked about it on the call earlier this morning, best in the business. I couldn't agree more. They are phenomenal. They are based in Utah. They literally, I've had other brokers be like, everyone there is just so nice. They're just so friendly and happy. Like, what's in the water? I don't know. It's a very, very wonderful team. And I want to call out the care team specifically because this is really unique to Molina. It is a dedicated service team to help you with member-related issues without needing the member to, fill out an authorized rep form or be on the line or anything like that. They are there to help you. I've had covered California had some technical difficulties this year. So, there was just some issues in the files, things were missing, maybe the, billing didn't come over with the enrollment. So, the broker care team was a lifesaver. They helped with all of this stuff. They can do any PCP changes, medical group changes that you guys need. The member was termed for any reason that isn't accurate, they can also escalate that. They have some limited information on claims, but if they'll get in contact with the right people when it comes to getting those issues addressed. If you bring them and they not in their purview, they will bird dog it to help make sure we get the members' issues addressed. So I could go on all day, but I did want to update this slide. I didn't get to yet. They expanded their hours already. We are open now at 6 a.m. Mountain Time, closing at 7 p.m. Mountain Time. So, we're having those extra hours for everybody, and they will be having some Saturday hours in November and December, but we'll be doing a broker e-blast to get you guys those updated timetables as soon as they're set. Oh, all right. That's the end of my slide deck for my payer services. So I don't know, Micah or Jeff, if there's any, questions on deck right now. Otherwise, I will send it over to Gabe so he can start talking about Texas.
You see any questions there, Jeff?
No, I think we're good to move forward. Great information there. Thank you.
Thanks. Thank you. All right, Gabe, take it away.
All right. Thank you so much for allowing me to talk about the great state of Texas. Lots of great things happening for 2021 OEP. I'm extremely excited to share this information with you guys. And I know some of you are Medicare agents, and I know there's some overlapping between AEP for Medicare and, of course, open enrollment for Marketplace. But just remember that come December 8th, you guys need to put your Marketplace hats on, and keep in mind that you really don't have anywhere near the marketing restrictions for Marketplace that you do with Medicare. So, I mean, the sky's the limit in terms of your creativity in terms of getting in front of selling opportunities. And remember, the under 65 market will become T65s eventually. And Marketplace is a great foot in the door or great door opener for other ancillary products. So, speaking like a true agent that I am here. So anyway, I do want to talk about the great things that are happening here in Texas. Of course, we are expanding our footprint. Again, Amy alluded to the areas shaded in gray. That is our Medicaid footprint. And so you see here, there's a lot of opportunity for growth in Texas. But we will be moving into Bexar County, which again, these are our expansion markets are highlighted in yellow. Bexar County, which is the San Antonio metropolitan area, Denton and Fort Bend, as well as Montgomery and Tarrant County. So I want to talk about these markets specifically. I know them, pretty darn well. With regard to Harris County, so Harris County has historically been our top county, our top market. There's a very large Latino population and a very large Asian population, specifically Vietnamese. Jefferson County has been a very strong market for us, which is the Beaumont-Port Arthur area. And then, of course, with the addition of Montgomery and Fort Bend counties here on either side of Harris, it just really opens up this opportunity for new Molina membership. There's just so much potential in this market, and I fully predict that it's going to continue to be one of the top markets for us moving forward. As we move up north, 2020 OEP with Dallas and Collin County. Dallas was our number 2 market, Collin County number 3 market. And of course, we only kind of had half of the DFW market, but with the addition of Tarrant and Denton County, I mean, it just really opens up that DFW metroplex, which, you know, DFW is the largest metropolitan area in the state of Texas. Tarrant has about a 30 to 35% Latino population. Denton, about a 22 to 25% Latino population. All that translates to is opportunity for new Molina membership, just tremendous opportunity. And then when I talk about Bexar County, I get super excited and almost fall out of my chair because there is just so much darn potential in Bexar County. We have a tremendous established footprint with our existing Medicare and Medicaid line of business. The community at large in Bexar County know Molina. They're very familiar with the Molina name. And Bexar County has about between a 70 to 75% Latino population, with many, many communities that really kind of fall within our ideal member, our ideal demographic, which is the highly subsidized individual and family. I fully predict that Bexar County will become the next Harris County for Molina Marketplace. So super excited. And then of course, you know, El Paso and out in West Texas has always been a very, very strong market for us as well. You have Webb County, which is the Laredo area, which has been very strong for us. Starr County, down in the Rio Grande Valley area, Hidalgo and Cameron County. Again, all great markets, and I predict that, you know, with the new benefit design for 2021, competitive pricing, I mean, we should do very, very well across all markets. With regard to network, so I've gotta speak to our network. There has just been tremendous work done with our Texas network. You know, I've been a licensed agent since 86, 87, somewhere in that time frame. I spent about 20 years in personal production. So I know and I understand how important network is, among many other things. So I've had laser focus this past 6 months on network. And I've worked very, very closely with our provider relations team with regard to auditing the existing network as well as the expansion markets. As a matter of fact, a third-party vendor was hired to audit the network. In addition to that, a communication piece went out to our existing provider network with the goal of accomplishing a few things. Number one, as a reminder, you guys are contracted with Molina Marketplace, okay? And so we want to make sure that there was a separation of plans as well. If a member calls into a provider staff and asks, hey, do you guys take Molina? Well, the provider staff person might be thinking Molina Medicare, they might be thinking Molina Medicaid. No, it is Molina Marketplace. And then the other goal was to, with this communication piece, was to flush out any potential issues or questions prior to open enrollment so that these could be addressed and we could be ready to go for 2021. So a lot of work. We continue to work on network. We know how important network is, and so more to come on that. With regard to the network in Bexar County, we have a very strong, very solid network in the San Antonio Metroplex area. Baptist Medical System is huge. We have, of course, the HCA Methodist system, which have facilities throughout Bexar County. But we do also have a network advantage, which is going to be very, very big for us. University Health System is the county hospital in Bexar County. Our competition does not have the county hospital in network. And if you think about our ideal member, highly subsidized, 100 to 200, 250 FPL, this is the network. And these are the facilities that our highly subsidized member utilize for the most part. So big network advantage there. I also caught wind of a clinic group that was coming in from Florida. I believe they are in network with us in Florida by the name of Telehealth. And they were coming into San Antonio, the Bexar County market, with opening up 4 clinics in very key areas. They serve the highly subsidized community. I immediately reached out and we got them onboarded. They're going to start out with 4 clinics and will expand to 10 clinics by August of 2021. Super great addition to our network. And then of course we have some FQHCs, low-income clinics scattered throughout the southwest, west, southeast, and east sides of Bexar County, which are traditionally the highly subsidized areas in town. So a lot of potential for San Antonio. Of course, you see Cameron County there, VHS system, Collin County, and then of course Dallas County with Methodist system, Kindred Hospital system, and of course you see the HCA Medical City, El Paso County with the Hospitals of Providence. University Medical Center is the county facility in El Paso. We do have a network advantage with the county facility in network. They have 10 clinics throughout the El Paso County area, including Fabens, which is way east on the outskirts of El Paso County. So we do have an advantage there. Fort Bend County system, and then of course you see Harris County. With the St. Luke facility, you have the HCA facility, and of course the flagship Memorial Hermann system. We have just added the clinic system for Memorial Hermann. So they have clinics throughout Harris County. And of course, we've added all the affiliated providers as well. So that is going to be huge, a very huge addition to the network in Harris County. Additionally, we had some gaps within the Asian providers, the huge Asian community in Harris County. So I reached out to a community center in Harris County that serve as enrollment assisters and navigators for the Asian community. And I asked them, in your opinion, who has the most comprehensive network of Asian providers? Well, they said, a Medicaid facility or carrier by the name of AmeriGroup. I obtained the PCP list and specialist list for AmeriGroup and passed that over to our provider relations team, who had immediately reached out to many of the Asian providers to make sure that we filled any gaps that we had within that community. So, like I say, just a lot of work has gone into network. With regard to Hidalgo County, Valley Baptist Medical Center is a very popular facility in Harlingen, South Texas Regional, Rio Grande Regional Hospital in McAllen, Doctors Hospital at Renaissance in Edinburgh. You've got Jefferson County, Montgomery County with the St. Luke system, HCA Houston Healthcare, of course, Starr County, and Tarrant County. Now, Tarrant County, we're still negotiating with a couple of facilities there, but we do have JPS, which is the county facility in Tarrant County. I do know that Oscar Health does not have the county facility in network. And so I think it's going to be very, very interesting. We have a very strong network there in Tarrant County, and it's continuing to grow. Webb County, again, Laredo has always been very strong for us. And so you see facilities there. So network, with regard to Texas, is it at 100%? No, probably will never be, and it will always be a work in progress. But I think we've made tremendous strides in Texas, and I'm really, really banking that, it's going to pay off for 2021. With regard to benefits, we do have a new bronze and silver plan design for Texas. Our 2021, let me move this here. Okay, 2021 offerings, we have, of course, a bronze 1 and 2 renewal option with an adult vision option. We do have a core care bronze 4 and 5, which I'll talk about here in just a moment. It is our new offering for 2021. Constant care silver 1 and 2 with and without an adult vision as a renewal option. We do have a constant care silver 4, a new option for 2021. And of course, our confident care 1, which is a renewal option with and without an adult vision option. So our core care bronze, we do have offerings with 0 deductibles for 2021, all preventive benefits and services to include Teladoc virtual care services at no cost, very low copays for primary and specialty care services. And as I mentioned, all annual wellness, preventive prescriptions, all preventive services at no cost. Constant care silver plans, free preventive care for adults and children. The Teladoc virtual care at no cost for 2021. Plans with copays for primary and specialty care, as well as mental health, lab, and all the diagnostic services, excuse me, all the diagnostic services, as well as plans with low to no deductibles for our constant care silver plan for 2021. Confident care gold, it's really the gold market, the gold tier is really not our, our ideal market, but we will offer very comprehensive coverage for those higher income individuals that want, more of that traditional 80-20 coverage. Preventive services are still at no cost, Teladoc at no cost. We will have some options with and without adult vision, no cost preventive care, access to primary care without deductibles, and of course, Teladoc at no cost. And of course, avoid higher emergency room costs with primary care, urgent care at PCP copays. So, still very comprehensive coverage, just not necessarily our target market. So our core care bronze 4 is our new offering for 2021. You'll see a 0 deductible option, max out of pocket, along with our PCP and urgent care copays, which are the same. Again, Teladoc at no cost. Inpatient copay options, 2 copay maximum for an inpatient stay. And then, of course, you see your prescription drug deductible and tiers 1 through 4. That is our core care bronze for new offering for 2021. You see our constant care silver 1, which is a renewal option for the highly subsidized market. Again, 100 to 250 FPL. Deductibles at 0. Your max out of pocket, you see PCP and urgent copays at 0, and they are the same. A very low specialist copay, 2 copay maximum for inpatient stay, 0 prescription drug deductible, and little to no copays for tier 1 and 2 prescription drug. And then, of course, as the income increases closer to that 250 benchmark, or FPL level, you'll see that the out-of-pocket expenses will increase along with that. With regard to our new offering, Constant Care Silver 4, 100 to 250 FPL. Again, you'll see your deductibles there at $725, max out of pocket, $7.25. PCP and urgent care copays are at $0. Specialist at $10. Again, Teledoc at no cost, along with all preventive services. 2 copay maximum for inpatient stay. Your prescription drug deductible is embedded within the medical deductible. And then, of course, you see tier prescription drug deductible, or rather copay tiers 1 through 4. There is no adult vision option on the Constant Care Silver 4. And as the income increases along the FPL chart, closer to that 250 range, well, you'll see that the out-of-pocket costs increase slightly. With regard to our Gold plan, Confident Care Gold 1 is a renewal option. We will not have a new offering for 2021, but we still provide very comprehensive coverage as a renewal option. You see your deductibles, your PCP and urgent copays, inpatient stay with 20% coinsurance, and then of course your prescription drug deductible is embedded within the medical deductible, and then of course your tiers 1 through 4. There will be an adult vision option to our Confident Care Gold. Now, there's a lot of information here. I'm going to just touch on a few highlights, but you will have access to this information where you can absorb it kind of at your own pace. So this is our Texas Standard Plan, and you'll see that everything in green, shaded in green, are services without any deductibles. And this is essentially at the 250 FPL level, so higher income market. But you'll see here the Core Care Bronze 4 and 5 with a 0 deductible option. Your prescription drug deductible is embedded within the medical deductible for tiers 3 and 4. Again, inpatient stay, 2 copays for an inpatient stay, 2 copay maximum. Your PCP urgent care copays are the same. And of course, your prescription drug tiers 1 through 4. So you'll see the, again, Bronze Plan 4 and 5. These are our new offerings for 2021, 0 deductible options. So one thing that we're doing a little differently for 2021 is really going more towards a fixed cost model by implementing more copays and less coinsurance. And we feel that this will provide more predictability in terms of out-of-pocket costs for our ideal client, our ideal member, which is the highly subsidized market. I think that it will resonate really, really well with that demographic. With regard to the Constant Care Silver option, this is a renewal option for 2021, Silver Plan 1, 2, and 3. Of course, all preventive services to include Teledoc are at no cost. You will have some 0 deductible options available. Your prescription drug deductible options, you will have your prescription drug embedded with your medical deductible on Silver Plan 2, and that's for tiers 3 and 4. So you have some variations there. With regard to your inpatient copay, you have a 2 copay maximum for an inpatient stay, and that is renewal option Silver 2. For your outpatient services, your PCP, urgent care specialist copays you see here. You'll see a little bit of coinsurance kind of embedded along with this, but again, you know, less coinsurance, more copays. And then, of course, prescription drug tiers 1 through 4 copays. On our new offering, Silver Plan 4 for 2021, again, you see your deductible options here for individual and family. Your prescription drug deductible is embedded with the medical deductible for all tiers. Inpatient hospital stay, 2 copay maximum. And of course, all outpatient services and diagnostic testing, you'll see our services. You will see PCP, urgent care specialist copays, and then of course your prescription drug tiers 1 through 4. The Confident Care Gold, again, no new offering for 2021. So Gold 1 and Gold 3 are our renewal options for 2021. Again, still all preventive benefits, Teledoc at no cost. You will have a 0 deductible option, Confident Care Gold Plan 3. You will see the prescription drug deductible for Confident Care Gold 1, which is embedded with the medical deductible, and that is for tiers 3 and 4 only. Your outpatient services, copays listed here, PCP, urgent care are the same. And then of course, all the diagnostic testing and services along with your prescription tiers 1 through 4. So still, you know, very comprehensive, very competitive coverage in the gold category as well. With regard to our ideal demographic, this is what we call the Texas Silver Cost Share Reduction Plans, or CSR plans, for 2021, really geared more towards the highly subsidized individual and families that fall between 100 and 200 FPL. So you'll see Silver Plan 1, 2, and 3 are our renewal options for 2021. And also keep in mind, any of your passive renewing clients, I would encourage you to reach out to them, because as you're seeing here, there might be a better option suited for them for this coming open enrollment. So don't just let your clients passively enroll. I would definitely reach out to them and see if in fact there is a better option for them. I kind of think there is. But here, so Silver Plan 1, 2, and 3, of course, all preventive services at no cost. You'll have some 0 deductible options available. Your prescription drug deductible, you'll have some 0 deductible options for prescription drug available as well. With regard to hospital inpatient stay, again, 2 copayment maximum for plans, Silver Plans 1 and 2. Your outpatient services, primary and urgent care are the same. You will have a 0 deductible option available. Prescription drug, of course, all your diagnostic services as well. And then your prescription drug tiers 1 through 4, little to no deductible options there as well. With regard to our new offering, Silver Plan 4, again, for the highly subsidized member between 100, 200 FPL, free preventive services to include Teledoc. You'll see your individual and medical deductible options here. And of course, as income increases up the FPL chart to 200, those out-of-pocket expenses increase along with it. For prescription drug deductibles, you'll see that it is embedded with the medical deductible on all the options there for Silver Plan 4. Inpatient stay, you have a 2 copay maximum across all options here. And then your outpatient services, 0, low to no deductible, depending on where your client falls within the FPL chart. But very, very competitive benefits for 2021. You see your prescription drug tiers 1 through 4, little to no copay. Super exciting because these benefits are super competitive. And I guess we can answer some questions at this point.
Yeah, let's see. And So going back to the Texas map, if you had to pick which areas you think you're going to be the most, now obviously we don't know for sure until you actually can quote it and all that, but if you had to pick areas where you would focus on the most, where do you think would be the biggest opportunities?
Well, Harris County has always been a really strong market. It's been our top market, historically. But I think from a competitive standpoint, from a network advantage standpoint, from a brand awareness standpoint, I'm putting a lot of stock into Bexar County because,
Okay.
yeah, absolutely.
And because of the expansion.
Absolutely. San Antonio market.
Yep. Statewide, do you have an idea of what kind of effect this year is going to be on your rates compared to last year? Are they statewide going up, down? Do you have any idea?
We feel really good about where we are at. Of course, the elephant in the room is the effects of COVID, that type of thing. But I really feel that between new plans, the new markets, I think from a price perspective, I think we're going to give a lot of the competition a run for their money this year.
Okay, good. Because that's one thing we always talk about is just opportunity, and the biggest opportunity for us agents is not so much going after the carrier that has all the business in the area. It's the carrier that's going to improve or going to expand into areas where there was only one or two carriers, and really coming in with a strong product and taking over that. That's where Messer
Absolutely.
Financial and our agents seem to always have the biggest opportunities each year.
Absolutely. Well, Tarrant and Denton County are going to be super strong. I think, really all of our expansion markets, Fort Bend and Montgomery, agents have been clamoring to be able to offer Molina in these markets, and now they will have the ability to do that. And then, of course, San Antonio is just going to be huge. So a lot of opportunity.
Okay, awesome. Jeff, did you see any other questions on the log?
No, I think we've done a great job covering the information. I would ask, has there been any significant pickups in terms of networks anywhere that we need to make these folks aware of, or a hospital system maybe that was brought on board for 2021 that maybe makes a difference in the market?
Well, I think in Harris County, the addition of the Memorial Hermann Clinic system is huge, because there are just a tremendous number of clinics throughout Harris County, and of course all the affiliated providers. In Bexar County, we do have a network advantage with University Health System, which is the county hospital. Our competition does not have University Health System in network, and that's going to be very, very key for us for 2021. The UT Health System has facilities throughout Bexar County in those very key, highly subsidized communities. So I think that's going to be a huge factor for us this year.
Awesome.
All right, I think that's what we got. We can continue to keep moving, Micah.
Yeah, absolutely.
All right. If you guys can just let me know if you can see my screen there.
Yep, you're up and running, man.
Fantastic. Thanks so much. And as always, it's always great to meet with all of you. Messer is a phenomenal partner for us here at Molina. They do such an amazing job of integrating with us as a carrier, but also helping you guys as agents. And so we truly appreciate their partnership. Hey, my job is easy moving forward. Amy did a phenomenal job in presenting our overall overarching benefits and added services to our members, and Gabe did a fantastic job of explaining our benefit design for all of our FFM states. And since I run both of my states are FFM states, I won't go into too many details when it comes to those benefits. But let me give you guys some talking points when it comes to the state of Utah and New Mexico. In the state of Utah, we are not expanding in any new counties. So we are going to stay along these counties that are highlighted in green. The biggest difference that we are going to notice in this state is that there is going to be some significant rate reductions. In our gold tier, we reduced our gold plans about 28%, give or take a few points. And so there is going to be a huge opportunity to sell gold plans throughout the state of Utah. Along with that, we've definitely reduced our silver and bronze pricing to be more competitive. And as I get further along into my presentation, I'll talk to you guys about what's going to be the biggest distinguishing factor for us in the state. But as you can kind of see here in this list here, in Utah, there's 4 major counties where most of the population lies, and that is in Utah County, right here in the middle of the state, Salt Lake County, Davis County, and Weber County. These 4 counties here is what we call the Wasatch Front, is where most of the population is at, and that's where you're going to probably get your biggest bang for your buck. Utah is known here locally as a very diverse state, and so if you do have any call center capabilities and you guys are doing any kind of marketing along any part of our state, there is a significant portion of the population that is Hispanic and Spanish speaking. And so there is great opportunities, especially in Salt Lake primarily, and in Washington County, which is down south near St. George and the Nevada border. There is a lot of Hispanic individuals that are enrolling into the marketplace. And so that is a huge opportunity for us. And so we're going to see a lot of shifting going on in pricing. We're going to become very competitive this year. And I think that's going to be the overall theme in the state of Utah, is that the opportunities are abound here. Our silver plans have received a deduction, and so that's going to put us in a very competitive spot. There'll be a few counties where we will be priced possibly the lowest, but for sure the second or third lowest. And just because we're not the lowest price, it isn't a sign to not sell us, and this is the reason why. Most of our competition in there has a very similar network that Molina had this last year. Moving into 2021, we are bringing in the University of Utah, and so that grants us an access point that most carriers in the state do not have. And so that is going to be our biggest advantage. We're going to have the University of Utah, HCA or Mountain Star Network, and Steward Health Systems, which are the three of the 4 major hospitals in the Wasatch Front area. And then in the rural counties, we do have the Intermountain Hospitals, which is the sister company of Select Health. And so we feel very confident that bringing on the University of Utah will give us a tremendous edge this year. So, when you're comparing the other plan or two that's, around the same price point as us, if we're either, cheaper or a little bit more expensive, the question would be, hey, why not have all of the hospitals in the network versus just a select few with the other guys? And for anyone that is local or who has sold in the state of Utah, they know how much weight that carries. So we're extremely excited for that. As Gabe was mentioning before, we're introducing some plans that we've never seen before in our portfolio, and those are the $0 deductible silver and bronze plans for the non-CSR clients that enroll on the marketplace. And specifically here in Utah, we don't have Ambetter or any of those national players that are in our state, and so this $0 deductible plan for our silver and bronze plan is going to be extremely new for the state, and brokers, as I've talked to them throughout the last few weeks, are salivating over the fact that, hey, there's going to be a bronze plan that has a $0 deductible and some predictable copays. I mean, it's going to be a no-brainer. A lot of opportunities are going to come our way because of this and because of our rate reductions, along with the fact that Molina is testing something that is also fairly new for us here in the state of Utah, and that is what we're calling the gold rush era, or the gold rush movement here in the state. We're reducing our gold pricing about 28% here. And so depending on how the pricing looks in the silver market here in the state, there might be an opportunity or a chance that a lot of folks that are in silver tiers might opt into the gold plan because it's going to be fairly priced and very comparable to the silver pricing. And obviously, the gold plans come with some distinct advantages for those high utilizers, where the out-of-pocket max is significantly lower than what the silver and bronze plans have to offer. And so that's where the appeal is, right? If a member that uses their silver plan quite a bit has the option to pay a little bit more, but get into a gold plan, that there is some advantages there. And so with these three things going on here in the state of Utah, I am excited. We have some very exciting and very aggressive goals to go here, to grow here. Back in 2017, when we were at our peak enrollment here, we had about 70,000 enrollments in the state. And so we're definitely itching and eager to chip into that amount to try to get as close as we can to that. Granted, I think it's going to take another year to really get to that number, but this is going to be a great year to really kick it off. And so if any of you have any other questions about the Utah market, please let me know. I went ahead and put a list of our hospital systems here. Unlike Texas, where it takes 5 slides to kind of illustrate all of them, we can do that with one slide here in Utah, just because it's a smaller group of hospital systems, obviously relatively smaller state, obviously, but the opportunities abound. For those that are gonna move into the state of Texas, let me just make sure that I'm clear. So as you can see here on the top left corner where it says Intermountain Hospital, with the exception of Primary Children, all of the other hospitals are in our rural parts of the states where we're in. Primary Children is the one that's like in Salt Lake City. We don't have Intermountain in the rural parts, that Wasatch Front that I was talking about before, but in that in that urban area, the Wasatch Front, we do have Mount Star, HCA Hospital System, Steward Health, the University of Utah, and all of the independent hospitals that we categorize as other hospital systems in the Salt Lake area, along with the rural parts of the state as well. So very excited, guys. I went ahead and included a copy of the benefits at a glance, and for some reason it looks a little blurry here, but we'll clean that up when we send out these copies. But yeah, the benefit grid is the same. The only difference is that in the state of Utah and all other FFM states, we don't have those standard plans that Gabe was talking about, but all of the other plans that we have, our core care bronze plans, our constant care silver plans, and are all part of the Utah plan design here as well. So really excited about that. If I don't know what would be best, Micah, if we maybe do questions about Utah now, or do questions for Utah, New Mexico at the end after I talk about New Mexico. I take that as I'll just keep going for now.
Yeah, let's do New Mexico. Yeah.
Okay. So jumping into New Mexico, for anyone that's recruiting or using their call center to promote, the nice thing about New Mexico is that it was our first ever state where we are contracted in all counties in the state. So all 33 counties we are participating in. So there's no, guessing on, hey, where is Molina at in the state? We're in all 33 counties. New Mexico is infamous for having relatively affordable marketing. Your marketing dollar goes a long way. You buy some marketing dollars in Albuquerque, which is Bernalillo County, right above Valencia. You're getting some of that marketing across the whole state. And so there is some huge advantages to promote here. One thing that is very distinguishable for the state of New Mexico is that it is our lowest broker participating state. And what I mean by that is that out of all of the enrollments that exist, or all of the enrollments that we have, only 33% of that comes from the broker community. So the other 67% or so comes from direct enrollments, meaning that there's a lot of people in the state going directly to healthcare.gov, calling in, or possibly even just doing it online, where they're not getting any free assistance from experienced agents like all of you. And so if anyone's looking for a fun and exciting state to expand in, there's a lot of opportunities in the state of New Mexico. Bernalillo County, we're going to be very competitive in. Santa Fe and San Juan area is going to be, oh, sorry, not Santa Fe, scratch that. San Juan area is going to be a very competitive area for us. Dona Ana, which is Las Cruces, is also going to be very competitive. That butts up right against Texas, as well as most of the states here on the east side of New Mexico. And so there's some great opportunities that exist. As I mentioned, Bernalillo and all of the rural counties, Molina will have the lowest price silver plan in those areas. And so we have been looking at some of the preliminary numbers there. New Mexico is more transparent when it comes to pricing. So we have looked at the last filing, and it looks pretty clear that we will dominate in the silver area with Bernalillo and all the rural counties. San Juan as well, we will have the lowest bronze, silver, and gold plan in that county, as well as Las Cruces, which is right next to El Paso, Texas. We're going to be priced very well there. Bronze, silver, and gold will be the lowest, and we're looking to grow. If there is one other thing that I can mention in the state of New Mexico, is that there is an exiting of a carrier there. New Mexico Health Connection, which was one of maybe 4 or 5 co-ops in the whole nation, is actually closing down shop for this next year. So their 12,000 or so members are going to be shopping around or looking around. And so there is some, marketing advantages to that, promoting yourself as, the experts of other options, as New Mexico Health Connection exits the market, can give you a big advantage. So we're thrilled for the opportunity. It's incredible for us to see that, year over year, there's always new gems that pop up in every state. And depending on the eagerness of your growth and where you guys want to go as agents and as agencies, there's definitely opportunities everywhere. And so hope you guys can take advantage of that here in the state of Utah and New Mexico. I actually got copies of our benefits at a glance for the state of New Mexico, because we had to get some things filed and approved with the state. And so you guys have these copies readily available. The distinguishing factor between all of our FFM states, which New Mexico is that for state-specific reasons, the state did not want us to introduce our $0 deductible silver plans. So those new silver plans will not be in the state of New Mexico. We'll have our other cost-sharing reduction plans like we've had in years past, but there won't be any new plans for the silver plans in the state of New Mexico. We will have our $0 deductible plan in our bronze tier, which is new, and as like Utah, this will be a first time ever where there is a $0 deductible plan in the state of New Mexico. So we don't have some of those national players here, or have been here for the last couple of years. So this will be something that's completely new to the market. So that's going to be a good selling point for all of you brokers. And I went ahead and included a few other slides here. But as Gabe mentioned, we build our plans based on predictability for our customers so that they have the best customer experience. And so you'll see these little highlighted, aqua blue services where there's flat copays associated to those services, and that helps our members to utilize their services appropriately and not be stuck with a huge question mark on how much they're going to have to bill due to co-insurances and stuff like that. So these plans will definitely set us apart, and we're excited to kind of get out there and sell them and really promote them in the different counties that we're in. So as I said, just more plan design here. When it comes to our hospital system, guys, in the Bernalillo County area, which is Albuquerque, we have all the major hospital systems with the exception of Presbyterian Hospital System. Presbyterian, from what I know, does not contract with anyone outside of their own off-exchange plans. So when you're looking at that, we have a very robust network, and it's very comparable to all the other carriers that are in the market. Along with that, in all of the rural counties, we do have all the hospitals that are in there, including some of the hospital systems in West Texas and El Paso as well. So we have those marked down here so you guys can kind of see that. But outside of that, guys, I mean, great opportunities abound here in New Mexico and in Utah. Would love to help any of you out in whatever I can to be more familiar with the states, especially if you're going to be doing some marketing out here. I would love to kind of help you guys target, whichever demographic you guys are looking for, whether that's the English-speaking demographic, Spanish-speaking demographic, American Indian population in both of our states. Those are some pretty big, populations in Utah and in New Mexico. So whatever I can do to be a support, we would love to do that. And as usual, this is my most uncomfortable slide because I hate having that selfie of me or that picture of me up, but this is my contact information. Feel free to reach out to my cell phone or to my email address, and I'd be more than happy to help.
Thank you, Adam. That was great information. Sounds like there's definitely some opportunity. We want to get agents familiar with you as well, because we definitely recommend our agents to have good relationships with their local broker reps, because at the end of the day, we're all in this together, right? We want to make sure that
Absolutely.
everybody succeeds. So please make sure all of you that are listening that you keep this contact information down and keep him posted to anything that you guys are looking for to do.
Awesome. Well, thank you so much for the opportunity, guys. You guys have a great day, and I think we're passing the ball to Casey, I believe.
Thank you, Adam.
Yep.
I'm ready for you whenever you are. This is Casey. I'm the broker channel manager, or marketplace sales manager here in Washington State. Going to talk about what we've got going on. Thank you so much for having us all out here today to talk about our markets in length, and we'll try to get us back on track here. So, Washington State, we are a state-based exchange. Our open enrollment has been was set earlier this year, November 1st through January 15th. So November 1st, any enrollment completed November 1st through December 15th, the normal target date, will result in a January 1st effective date. Anybody who enrolls December 16th through January 15th will have that February 1st effective date this year. So a little bit more of an expanded open enrollment season. Here today, obviously to make sure that everybody's ready to sell, ready to go. The big thing in Washington State, we do have our own certification process through the Washington Health Plan Finder. So that is something that you'll want to make sure that you brokers take care of before the end of the year, that they are recertified or certified with the Washington Health Plan Finder for 2021. So I'm Casey. Here's my contact information. A little bit earlier on the slide, this will be provided later, but let's go ahead and jump straight in. Market highlights from kind of a bird eye view here over the next few slides. Here in Washington State, we had some pretty significant expansion last year into Snohomish and Kitsap County. Snohomish County is the second most populated county in Washington State. But here moving forward for 2021, no expansion counties at this time. We do have some finalized rate changes here. This is an average rate change across all of our plans, but there is some variability. I know we went down a few percentage points here in Washington. Got some more details on this last night. Actually, the Health Plan Finder came out with a press release. So yeah, it's anywhere between about 2 and 7%, depending on the market that someone is in, that our rates are going down this year, which is really welcome news here in Washington State for those folks that are currently enrolled with Molina and looking to renew. Always a welcome sign when they get that renewal letter and it shows that rates are going down. So here in Washington State, we've got 2 different product portfolios. So this is kind of going to be the bulk of the presentation here this afternoon for you. So we've got 1 market and 2 plan design portfolios. The first is going to be pretty familiar to you at this point. It looks pretty similar to what you've seen so far from us today. These are our non-standardized plans. These are basically the carrier's choice, the ability to pick and choose and design their own product portfolio. So these plans will, like I said, closely resemble what you've seen so far from my other colleagues here earlier today. And then the second set of plans are our cascade plans, or our standardized plans. So I like to say that we like to do everything just like California does, just a year or 2 later or on down the line. So California, which has had the standardized plan model since the infancy of the ACA, we are adopting that in Washington State for 2021, which means that any carrier that offers an individual plan in Washington State will have to at least have a set of standardized plans. So it doesn't matter who the carrier is, but they'll have the same deductible, same out-of-pocket max, same cost share on down the line. So that is a requirement. And then on top of that, the carrier has the option to also bring their own options or their non-standardized plans to the market. From what we've seen and from actually a press release that went out yesterday, pretty much every carrier has opted to roll forward with the 2 sets of plans. Number of reasons why that is, but we are also one of those carriers that is doing that as well. So what are the similarities between the 2 sets of plans? First of all, the coverage policy is the exact same, so you don't have to worry about trying to figure out if one plan covers chiropractic or acupuncture care, and does the other plan care both plans cover the same exact services. The service area is the exact same, which is defined as the state of Washington, and then emergency services only outside the state of Washington. And then our network, provider network, is the exact same between the 2 sets of plans. So you don't have to worry about making sure that one provider is contracted with one or not the other. How they're different are the plan design, which we'll spend a little bit of time on, and then also the premiums also differ, mostly because the plan design and actuarial values are different, therefore they have a corresponding premium. So what the Washington Health Plan Finder does require is they do require this Cascade Care logo here that you see on your screen be present on any ID card or any material associated with a standardized enrollment. The other thing to note that adult vision does not exist in Washington State for the most part. There are add-ins that you can add, but these are not on either of our plan offerings for 2021. Here's just to kind of give you an idea of how the plans stack up against one another. These are our premium relatives. So you will see that our choice or our non-standardized plans are the benchmark there, and then the Cascade is the relative. So you'll see that our bronze and gold choice plans are less expensive than our Cascade by 2% in the bronze and 4% in gold, which can be a few bucks. And then our silver is pretty close to one another. In reviewing some of the finalized rates information that's come out in Washington, we're a little bit ahead here in Washington and pretty transparent with our rate filings through our OAC and what that whole process looks like. But yes, we are going to be the lowest cost bronze non-standard or our choice option in Snohomish, King, and Clark counties, which are 3 of the most populated counties in our state. And then our silver Cascade Care looks like it's going to be significantly less expensive compared to the other Cascade Care plans in the state as well. So really pleased with where we landed at from a rate standpoint this year, specifically in some of these target markets. So I know I've heard this question already a few times from the previous presenters, where do we want to target? Where do we want to focus? To me, the answer in Washington is Snohomish, King, and Clark counties for 2021. King is where Seattle is, Snohomish County just north of there. Snohomish being the big expansion county of last year, so we're still trying to gain some footing there. We had a provider addition at the end of last open enrollment. And then Clark County, which is down along the Washington-Oregon border. It's the first time we've been in, I want to say 4 or 5 years now, that we've been the #1 lowest cost option in that county. So there's an opportunity there to gain some market share as well. All right, so already heard a little bit about our plans that we're offering in Washington State, the $0 deductible option in the bronze and silver tiers. The selling points and the benefits, these don't differentiate at all market to market this year. Where they do differentiate is, so I'm not going to spend any time here on this slide in the interest of time, but where they do differentiate are the cost shares. So you'll still see same deductible, across same with the FFM states of that zero deductible, out-of-pocket max, the exact same, but the cost shares will differ from market to market. So I think, we saw in Texas, I think it was $30 if I remember off the top of my head, where it's for primary care. Here it's $60. So it can differentiate, market to market, but still, we are going to this model because we polled our membership, and a big hurdling block for our membership was just transparency and cost, and not knowing how much it would be to go receive some sort of service or see some provider. So we're really taking some strides to roll that out this year. So we're really excited about going to the model. We think it's going to be a game changer. It will definitely be in Washington. We don't see anything close to this sort of model. And along with our price positioning and our provider network, which we'll talk about here in a moment, we're sitting pretty well for 2021 to kind of keep pushing that egg cart forward, just like we did this past year. So silver, same thing. You've seen these slides a number of times here today as well. Obviously we've got expanded Medicaid here in Washington State, which is different from some of the presentations you've heard today. So folks are eligible for Washington Apple Health or our Medicaid program up to 138% of FPL. So the silver 100 is the 138 to 150, and then the 250, this is kind of the above the 250% FPL, and kind of what the regular for the non-standardized crowd looks like. And then a Confident Care Gold, been involved with Molina the last few years. This probably looks pretty familiar to you. So not a whole lot of changes regarding this plan this year. Cost share is relatively the same. The big thing to note is last year we matched up all of our urgent care copays with our primary care copay. This year, extending that teledoc virtual care benefit is going to be $0 across all of our plan offerings, mostly in response to COVID. But yeah, same thing here. We just launched, virtual care this last year in Washington State on January 1st. Had no idea that it would change as drastically as it did a few months later. So we do have, our Office of Insurance Commissioner here does have a 30-day order that has been renewed time and time again regarding cost shares for these sorts of services. So we've just gone ahead and extended that, through the end of the year and then in through 2021 as well. All right, so now I'm going to talk about Cascade Care. This is where Washington is showing our uniqueness, if you will. We are the first state in the country this year to offer a public option plan. And I'll talk about what that means. But this Cascade Care, or Senate Bill 5526 from last year, was enacted in response to the rising premiums and deductibles and declining enrollment in the individual market. And then there was a piece of legislation in 2018 where we tried to enact a state reinsurance pool that wasn't able to get done. So 2019, this is what came to the forefront and got through legislation. There are three parts to the Cascade Care bill. The first is the standard plans, which I'm about to talk about here in a second, but they wanted to create, more transparency, lower deductibles, lower out-of-pocket maxes, and more benefits that were not subject to the deductible. So something that Molina has done pretty well in Washington State, the last few years. So it's not a big leap for us. We've taken obviously one step further with the zero deductible, so not too big of a hurdle for us to accomplish this year, but might be for some other carriers. The second part of that is the public option. Now the public option is I kind of refer to it as a pseudo public-private option, because it is actually a private carrier that bids on RFP, responds, and they win a contract. But basically, the aim behind these public option plans is they have set reimbursement rates for basically everything except for prescription drugs. So any sort of office visit, any sort of service has a set reimbursement rate, which, you know, is a few percentage points higher than what you see in Medicare. So the goal is to really make more affordable or lower premium options available across the state by having these specific plan designs. We, Molina, were interested in seeing if we could be part of the public option. We didn't feel like we had a long enough roadway to accomplish that for 2021, so we tabled that in the spring. There are a number of carriers that are participating this year. I think there are 5. 2 of those carriers have the lion's share of the market. United Healthcare out of Oregon and Community Health Plan out of Washington. From the initial rate filing, they weren't competitive, and then from the finalized rate filing, they are even less competitive. So the aim and the goal here for these plans, you know, with the lower reimbursement rates, to bring their goal was 5 to 10% less. There wasn't a pathway to make that happen just from the design. So you know, they're just going to be a non-starter in Washington this year. But those plans do exist out. There's obviously, you know, press behind it. There's a lot of interest about it. So, you know, it is going to create a little bit of confusion and create, you know, hopefully some interest as well in the individual market to, you know, capitalize on that uninsured population. But a big reason why we've extended the open enrollment date through January 15th, we do anticipate, or the Health Plan Benefit Exchanges anticipates quite a bit of additional activity because of the 3 sets of plans this year. And then the third part, the subsidy study, this kind of falls in line with, you know, following our big brother California down there, of going from 400% FPL to 500% FPL for a state advanced premium tax credit. So that's not coming to Washington in 2021, but there's a report due November 15th, potentially looking at 2022. So more to come on a few of these parts, but you know, it's definitely a lot of the driving force for what is happening in Washington State. So here are our Cascade Care, our standard plan designs. These are the exact same, no matter no matter what carrier offers them. So Kaiser, Premera, Blue Cross, Centene, on down the line. This is what you will see, at least at minimum, from each of the carriers. But as you can see, you know, pretty standard cost shares, you know, lower deductibles, lots of benefits not subject to the deductible. This gold plan that we have here is actually stronger than our gold option, where I would say that the other 2 aren't on paper. But you know, very low $500 deductible, very low out-of-pocket max, and then cost share, you know, copays for all 4 tiers of your prescription drug. So you know, for anybody that has, you know, very expensive RX or ongoing needs of some kind, or an expected medical expense, high utilization, this is going to be a pretty strong option for them this year across the board. All right, so just going to touch a little bit here on a network. We've got no changes in our provider network this year. So here's our comprehensive hospital list for the state of the 14 counties out of 39 that we participate in, adding Providence Everett last year, and Harrison Medical Center in Kitsap County. They're in the middle of the screen. Those were the 2 big additions last year. But But yeah, we do have one facility across the river in Oregon to help kind of make sure that we're meeting our needs there. But other than that, everything is pretty straightforward here in terms of hospitals. Our provider groups, pretty strong in the Puget Sound region. With UW, Providence, Harborview, Multicare, Franciscan, Everett Clinic. I hinted at that earlier today, but that is in the presentation. But that is our late addition during open enrollment last year. So they're in Snohomish County. So we actually have Providence and Everett, which is quite a feat to have both of those provider groups in Snohomish County. So it gives us a significant network advantage in that county, combined with our price position and combined with our schedule of benefits and some of the other member added things that we have kind of been rolling out the last few years. We feel pretty good about Snohomish County this year. Pediatric facility, we have all the large major pediatric hospitals in Washington State. Seattle Children's, which is King County, Snohomish, Marybridge, which is you'll find in southern Puget Sound, and then we've got Shriners, which is the large facility, preferred children's facility on the east side of the state. For Southwest Washington, we've got Vancouver Clinic and Peace Health. There are other Peace Health facilities in northern Washington. We are not contracted with those in Molina Marketplace, so this is just Southwest only. And then there's North Shore Medical Group, which has got a number of clinics right along the north side of the Columbia River. East side, we've got Providence and Multicare, and then we've got FQHCs throughout the state that help us meet the needs of our population that we serve. So why should I sell a Molina here in Washington State this year? We do have some enhanced new and renewal business bonuses. We did come out last year with commission rates and bonuses pretty early, right after Labor Day, and found that our competition came over the top. So been holding those pretty close to the vest. But what I can tell you here in Washington State is, yeah, we're enhancing our new and renewal business bonuses. We are raising commissions in Washington State for 2021. And the big piece of news is that we are grandfathering all of those old commission rates that you would have had, from previous years up to match our 2021 renewal rates. So in Washington, that have been a big bugaboo, thorn in our broker side. So this is one of those things where we listened and adjusted and took stock of what our competition was doing. So I'm really pleased personally about what speaking specifically for Washington about where we've pushed our compensation packages for 2021 and pushing it in the right direction. And then member ease of use, we've got teledoc virtual care services, which has been touched on plenty, I think, by Amy earlier today. And then we've got no referral, we don't require referrals for specialist visits. HMO, there are some large HMOs here, us included in Washington State. This is something that distinguishes us from them. We do allow the folks to assign PCP at time of enrollment, which helps for folks that have got doctor visits scheduled for either the first part of January or February, so they can hit the ground running. We've got our digital ID card and our enhancements to the My Molina site, our mail order pharmacy, which has just taken off like gangbusters since March for obvious reasons. And then with that, I'm just going to close talking a little bit about, been talking really fast here to try and get through and try and get us back on track, but just the Molina Cares Accord, we really do put our, we walk the talk, as I like to say. We had a $15 million provider initiative in June. We had some primary care and behavioral health providers that were struggling due to COVID. And so, we made an investment in those providers to make sure that they're still around because we needed them to help us service our vision. We had $1 million actionable item to help membership in Washington State earlier this year for folks that are suffering food insecurity as a result of COVID. And then just recently, we launched a $150 million initial contribution to help positive change for racial disparities affecting access to delivery of care, opioid use, rural access to care, social determinants of health, and care for the elderly. In Washington State, we've got in Southern King County, they are the most diverse zip codes in our country. We obviously, the whole east side of the state, we have is all rural for the most part, and we do have an opioid crisis here. So, it's very much we are investing into our membership and really aiming to serve the population as best as we can. And one of the things that I love about Molina. So I'd just like to close my portion of the presentation just always kind of on that high note after just tossing a bunch of information at you in pretty quick fashion here. So with that, that concludes my portion of the presentation here in Washington State. I'd be happy to answer any questions that you have.
No, that's great stuff. There's not really any questions, but I got to tell you, whenever you're raising commissions and making it easier to do business with you guys, while also showing that you care about the community, I think that's the trifecta. So I think you guys are really trying to set the standard when it comes to that, and we really appreciate that, and we hope to be able to bring a lot of business to you.
Looking forward to it. Well, I appreciate your time. Thank you much, and yeah, have a good rest of your day.
Thank you. And I think the last one, we're going to talk about California. Is that right, Amy?
Yep, last but not least, I will try and get through this as quickly as possible. So, yes, thank you very much. Got the screen here. There we go. Thank you guys for bearing with us. I know I talked a lot at the top, so I will try not to put anyone to sleep the rest of this training. This is my mug. The same feeling as Adam. I would love to be there in person to meet with you guys, but, being what it is, you guys have my cell phone, you have my email now. Reach out if you have any questions about this. I know I'll be covering it pretty quickly, but California is going to be a great market this year. We're sitting in the same footprint, but this is the largest population in California, and includes Los Angeles, of course, which is split into 2 markets: Orange County, Riverside County, San Bernardino, San Diego, and Little Imperial County over there on the border with Mexico. So this is us. As I mentioned, no expansions, but we are very likely to expand for 2022, so stay tuned. As of right now, we're really doubling down on our current footprint, which I think you guys will see in our rates. And I know Casey mentioned commissions, and Micah did too, so I do want to hit on that as well. We're going to see a big improvement in renewal commissions this year, so stay tuned. Very, very good news coming out probably next week, hopefully. So as soon as we get it to Messer, they'll get it to you guys, because it's going to be all good stuff. We are going to be the lowest cost silver, gold, and platinum plans in half of LA County. So as you can see that little diagram, if you know California, it's basically anything west of the 710 freeway, including the South Bay and the San Fernando Valley. And we're beating the next lowest cost plan by $6. Also the cheapest plan there last year, who we were just off by a few cents. They are now going to be the 5th lowest cost silver plan. So there's going to be some pretty big reason for movement there. So we're excited to pick up that business and help you guys pick up some of that business as well. Then moving on to the IE, which is east of LA County, we are going to be the lowest cost silver plan for a 40-year-old by $15. And those are the largest geographic territories, but they are still very largely populated. San Diego County looking great, a little over $24 from the next cheapest silver plan there. So we are very excited about San Diego County. We're also doing a lot of improvements across the board in our network. So I'll show that in just a minute. And Imperial County, it's a unusual setup there because it's only us. And actually there's 2 more carriers this year. One is entering, but they are even more expensive. So we are the cheapest by far, by $225 for silver, and we're the cheapest bronze there as well. So yeah, if you want to sell an Imperial, it is Molina country for sure. So this is a little sneak peek into the rates. Technically, they're not public yet, but they did make them public on their exchange site, so that's where I sold them from. But Shop and Compare for Covered California will be going live October 1st. They did confirm that, so you should be able to hope maybe it'll be a little earlier than that, but you can actually get in there and look at the plans. But as of right now, this is where we sit, and pretty good news on the silver plan here. LA Care is going to be the cheapest plan in Region 15, which is East LA County, but we got to beat in Region 16. Region 15, we're just not as competitive as you need to be based on some longstanding contractual obligations, and so we're working on those. But, it takes a while to renegotiate contracts, and we carry those costs for a couple of years. So moving on to Region 17, rosy picture here, Blue Shield HMO is the next lowest cost plan, but they do have a pretty slim network. So, HealthNet HMO is the next lowest cost over, and they're at $25 more than us. And moving on to our Orange County, not the rosiest picture here, but I do like to highlight we do have the lowest cost gold and platinum in Orange County, and the gold is not too far off of the silver plan. But this is Oscar country. They beat us there. They decreased their rates last year by 20%. We decreased our rates here by 8%, but we weren't able to catch up to them. So, but we closed the gap. So I do like to highlight that. Only $27 off. But, I think we should focus on San Diego County. Very excited about re-entering the top spot. We usually kind of switch back and forth with HealthNet or sometimes Blue Shield, but we beat HealthNet pretty significantly here. And very excited about retaining and growing business. And Imperial, I don't need to mention this too much. We are good to go across all metal tiers here. Benefit design changes. I like to move to this slide first because it's a little bit of a rosier picture. Not too many changes as far as out-of-pocket costs going, except for primary care, and that also is the same as urgent care for gold plans. The major changes really are impacting the maximum out-of-pocket cost. So the reason that Covered California was able to keep rates increases so low and really see a massive decrease in rates, I think LA Care was the only plan that had a larger average rate decrease than us. But the reason we were able to drop rates was because they, tinker with the max out-of-pocket every year. So it bumped up most plans a little bit, but the hope is that members would rather have a lower premium. Most folks don't even get close to that maximum out of pocket. So, if they are thinking about a maximum out of pocket and that's a concern for them, encourage them to move to, there's that platinum if they're interested. But our platinum plan is very cheap in all those areas that I mentioned. So, relatively to our competition. So keep that in mind if folks are concerned about that. Moving on to our hospitals. So I have to do each county separately because, California is a quite populous and large state. So we are, adding hospitals to our network constantly. We added the Kindred network. So you can see little stars there in the middle. We have Keck, USC, as well as City of Hope, which if you know, City of Hope is pretty much a nationally renowned cancer facility. So our folks do need to get a referral to go there, but that is required by the hospital, not by Molina. But that is just so that they make sure they're meeting that standard of care because that hospital is focused on those folks with specialty needs. And our medical groups, adding more folks here. Alliance IPA is onboarding 11-1, Hispanic IPA 12-1, Impact IPA, we're loading them as we speak, but that one is a very large group, several thousand, so it's moving slower than planned, but all these guys will be ready and effective by 1/1 for your members to access for 2021. Hospitals in Riverside, San Bernardino County, no major additions this year. We did add Eisenhower last year. And Arrowhead Regional is in a network, but I think Barstow we added as well. So, Loma Linda is, the flagship set of hospitals in the region, and of course we have them in network, all of their locations. So do like to highlight that. But we are working on a couple other negotiations for hospitals in Riverside County. So stay tuned. We hopefully will have some updates before January. And our medical groups, small but mighty. We have Impact IPA coming on board in Riverside and San Bernardino, but Heritage Writer Network with all of their doctor subgroups is in network. Vantage was purchased by Prospect, but we retained them through that process, and they'll still be under the DBA of Vantage. And we are building out a direct network. So I want to highlight that. It's not shown here, of course, but historically in San Diego, we've always done direct contracts as well as Imperial and medical groups in the IE. And we're building a hybrid model across all of our counties. So LA, we're also adding indirect providers, Orange County. So it's really going to just expand the network really significantly. And if any doctor is with us with a direct contract, we as a health plan do not require a specialist. So very similar to all of our other states where we are not really playing the gatekeeper in that way. If they're contracted, they can go there. IPAs and some groups require referrals, but that is up to the doctor and not a requirement from our health plan. Hospitals here, we did add Paradise Valley Hospital in San Diego County as well as Kindred, which is also, like in the heart of San Diego. Paradise is in National City, I believe, and adding, Impact and Hispanic IPA here. As I mentioned, the list is pretty small for medical groups because we've usually always done direct contracts, but trying to meet the needs of all of our members. Some of them like IPAs, some of them want that direct relationship with those doctors. So we are moving forward on both fronts in all counties. One caveat to hospitals here was UC San Diego. We did lose them a couple of months ago, but rest assured, negotiations are ongoing to get them back on board. There was some, payment issues. They wanted a few $1 million from us, which I think we've given them. So I think they're back at the table now, and fingers crossed. I've told that we should have an update on that any day now, and they're cautiously optimistic. So we don't want to count our eggs before they hatch, but stay tuned. Again, we are constantly working on making sure we have the best doctors and hospitals outside of UCSD. Of course, we have Scripps, Sharp, Rady's, all available to our members in San Diego County. And Imperial, small but mighty. There's 2 hospitals there. We got them, and the IPAs. Again, typically we contract directly with doctors because there's not those kind of big group footprints here, but we do have those groups here and are bringing on more groups of smaller doctors as we speak. In Orange County, here is our list of hospitals. We did add those 3 Kindred hospitals this year, as well as Impact IPA should be loaded in for Orange County next month, which is almost around the corner here. So next week, really, we should be seeing those showing up on our Provider Online directory. Again, that's part of the massive validation and an update of the directory that we are going through right now. So we are very excited to make sure that the information on our providers is as up-to-date and accurate as possible for you guys. And why so Molina, they covered on all this. I know we are, I think I did that in record. We're a little over here, but I hit the highlights, and I just want to say thank you guys for your time. I know there's a few of you who hung on this whole time, so thank you for that. Look forward to, working with you guys. And if we want to do a more in-depth training one-on-one, or you have other folks on your team that you want to train on any of this, I am free resource to you guys to get you up to speed in California. I know it's a little unique with Covered California State-Based Exchange. So yeah, happy. I used to work for Covered California. So I
so you know that.
Help the yeah, I do. So I've trained my fair share on just getting them, onboarded and trained with, the certification. So yeah, use me for any issues you guys might have.
Well, we always want to grow our footprint out in California. So if we got to wave the Molina banner all the way through the state, we have no problem doing that.
Well, we will be doing that as well. I mean, we are expanding our marketing in California quite significantly, and we're really hoping that builds, more brand awareness. But we are, historically a very large Medicaid provider. I think usually we're like the second largest Medicaid provider in each of our counties. And so we're doing a few different initiatives which I didn't touch on in the IE in San Diego to do massive marketing pushes there this year for both lines of business, Medi-Cal and Marketplace. So you're going to be seeing a lot of Molina in California this year, and really hope that drives more business to our brokers.
Wonderful. Well, again, we appreciate the partnership and you guys taking the time out to do this for us. For all of you agents out there, I hope you were able to see the opportunities and the potential that we have this year. Again, I've always said, all week that this is the year. If you're ever going to do ACA, this is the time to do it. New wave of people, new options, expansion, higher commissions, bonuses, new and improved benefits. I mean, it really is like the rebirth of the ACA throughout the country. So we're really excited about the opportunity. If anybody here has any questions, concerns, anything at any point, feel free to contact us directly. Or you can always contact Molina. There's, I know that they gave out. Do you mind putting that back up, Amy, the agent broker list, so that they could write those down just in case?
Of course. Let me pull that up here. I think it was one of my first slides. There we go. There we are.
And and Amy, just a quick question: if someone is Spanish or another language, you guys do have the capabilities, the agent support or customer support to be able to handle field calls like that?
Oh, yes, definitely. I mean, our broker support and our member services in all states is bilingual in Spanish. I mean, I hablo español bastante, pero Adam and Tina and Dennis and Gabe, they have a little more Spanish capability than I do, but our BSU also has multiple other languages as well, just from folks going on missions and things like that. So they have quite the capability, and in each of our member services, they do have that support in all threshold languages for Medi-Cal. So, California, I think that's Vietnamese and Mandarin, as well as a couple others. So, yeah, we as a company definitely have that language capability, and I know we also have Arabic with Kasai. So, yeah, we are fully available to help in Spanish and English and Arabic and anything else you guys need. We also have all of our materials in those Medi-Cal threshold or Medicaid threshold languages, and brokers, it's always English and Spanish.
Awesome. Well, Amy, again, thank you, and all the other presenters as well. Thank you for taking the time out and sharing all your information with us. And also thank you to all you agents that attended today. I know we went over a little bit our time, but again, I hope you feel that it was worth it. And feel free to contact us with any questions, concerns, anything. We're here to help you. At the end of the day, we're all in this together, and we all want to push towards the same goal, and that's making everybody successful. So with that, Amy, I'll give you any last words. Tina, anything you guys want to share before we leave?
No, I couldn't have said it better. I think this is, as you mentioned, it's going to be a record-breaking OEP, I think. With everything going on, healthcare is top of mind, and people see the value in it, I think, more than ever. And as carriers, we're seeing more competition. We're seeing better, rates and better commissions coming out. So it's just, it really is a very, very good year to be selling ACA. So best of luck to you guys. I hope you all have a wonderfully successful OEP.
Thank you, everyone, and have a great weekend. And I'm sorry, did you want to say something, Tina?
Yeah, just want to say if anybody is interested in the meetings from earlier today, I know you guys recorded it, but we also will be having state training specific to each state throughout the whole month of October, just in case anybody's interested.
And where can they find that information?
Broker support has the contact information for that, and you can reach out to any of the state reps that are listed on the screen. They can provide you that information as well.
Awesome. All right, guys. Well, that's all there is for today. Again, we appreciate everybody, and have a great weekend. Thank you, everyone.
Appreciate it. Thank you.
Thanks, you too. Bye, everybody.